All right. So good evening, everyone, and it's great to see a lot of our some familiar faces joining in today. And this is, I'm sure, going to be a very different look at the future of healthcare. I'm Dr. Faisal Nawaz. I'm based in Dubai, and that's where I've been sort of born and raised. And I had my medical school training here. I'm currently moving into sort of core training to become a psychiatry trainee in Dubai. And something that I have enjoyed doing over these past years is enrich my background and experiences when it comes to fields like digital health, research, and of course, the overlap of innovation between the two. So I hope you enjoy this presentation as much as I do. And of course, this is an open, session where your questions are just as welcome as the information that's shared. So I'll go right ahead. And I think what's important to see here is we're looking into a future where, we're currently practicing. Either some of you might be medical students or perhaps towards the early stages of your medical journey. Some of you may be joining in later into that as junior doctors or at any other path. And the question that comes is, considering the number of years that it takes to become a doctor and complete your training, what does the doctor of, say, 2040 look like? Because that's essentially what's going to be our ground for clinical practice. We're not going to be practicing in 2022. We're looking at a career where you're going to be passing through milestones, which is 2040, 2060. So this presentation is going to be about showing you what could be there and maybe trying to answer that question from what lies in the present with us. So just a brief background about myself, Dr. Faisal Nawaz. I have worked and see myself active in different organizations. Some of them are based in the UK, some of them are, globally recognized. So MBRU is sort of where I've done my medical school training in Dubai. And it's been a great 6 years as a medical student and then an intern. And then another organization is Health Careers Live, where this is based in the UK, and the goal of Health Careers Live is to sort of give you an idea of the different kinds of careers that exist in medicine. And this could be from a doctor's point of view, a nurse's point of view. So there's plenty of events and conferences going on that you could be a part of by looking at Health Careers Live. And then another exciting organization that I have led and worked with is the Clinician Engineer Hub, which is based in Cambridge. And the goal of this organization has been to bring together the field of clinicians, and then you have engineers who tend to work as though it's opposites, but rather there's so much of overlap between the two that we need a collaborative space for them to come together. So that's another cool place to check out, and I'd be happy to share more resources on these. And then I'm also quite active with a platform called DHPSP, which stands for Digital Health and Patient Safety Platform. So this is a group of researchers that are quite global in terms of their presence, and they work towards research projects in technology, in different sciences, and just a very open community for you to consider joining as a member. I'm also set to be joining as a psychiatry trainee, so I thought it would be nice to have a glimpse of that work as well, which will be at Al Amal Psychiatric Hospital, which is in partnership with Maudsley Health in the UK. So that's where I'm going to be training for the next couple of years. And in the background, I love spending time on social media. And that could be from, well, not just memes, but also from a professional side. So I spend my time sort of showcasing the different aspects of healthcare using Twitter and LinkedIn. So that would be a great place for us to connect. And depending on what your interests might be, I'd be able to give you some ideas, some opportunities. So I look forward to that as well. So So that's just my university campus, and it is probably just the beginning of the new year for a lot of those medical students, and I'm assuming it's very similar on your side as well. So to those starting, all the best with the year ahead, and to those coming to an end, I think it's the beginning of a new chapter on its own. So the topic and the big name, which is digital health, is something that brings a new meaning to all of us, and it could make everyone question, well, what does it really mean? And are we living in an age where digital health is something futuristic, or is it already here? So I think that the good news is digital health technologies, which are basically any form of technology that is helping improve healthcare, be it from a patient's point of view or a doctor's point of view, or even the community. These are technologies that exist as we speak today, and they come in different forms. And you might be familiar with a lot of them without even realizing it comes under digital health. So that could be something like mobile health apps, personalized medicine, telemedicine, the use of wearable devices, and of course, electronic medical records, which are now becoming a much bigger treasure than we would have imagined 10 years back. So the data that's coming out is being used in different ways to improve healthcare. So what is common in all of these is the use of technology. And I don't think we're living in a time where this is something that we dream about. This is true in different parts of the world, and digital health is not something that's in the distant future. And with great technology comes great market size. So it's good to also kind of visualize where are we headed towards when it comes to the future of digital health. And you can look at this graph where we're looking at, sometime in 2019, which is, before the whole pandemic shift happened, is where the market size of digital health technologies was about 175 billion US dollars, which on its own sounds like a big number. But fast forward to 2022, we're already double that size, if not more. And 334 billion US dollars are currently sort of in revenue in terms of the money, the investments, the infrastructure that's being built. And clearly there must be something about this technology and its use in healthcare that's making people project and estimate it to double again by 2025 to get to more than $657 billion. So for us as healthcare professionals or medical students, it is almost inevitable to ignore something that's going to play a huge role in the way healthcare is seen in the very near future. So that's promising stuff, but then we've got our share of challenges as well. And I'd like to see them as sort of a triangle of three main problems that exist today, which is stopping us from completely seeing the potential of digital health in action. One of them is global inequity, and that is, the inequalities that exist within healthcare. This could be inequalities in health systems, inequalities in education, in opportunities, in research, and in digital literacy. So what do we mean by digital literacy? Just necessarily means what is the current knowledge and awareness and acceptance of technology within people today. And it's quite surprising, and I'm sure you guys can relate to it as well, being in healthcare. Not everyone, even if you see senior doctors and junior doctors, not everyone is on the same page when it comes to being knowledgeable about technologies. And that's a big barrier we're facing, because sooner or later we're going to be having a lot of this technology in front of us, but then are we trained enough to be ready to use this? That's the bigger question. So that's the first challenge, global inequity. The second challenge that I see is privileged hesitancy. So privileged hesitancy comes from the point of privilege, as the word suggests, which is what professionals have today. So healthcare professionals like doctors, like scientists and others have the option and the choice to learn about digital health. But there is a certain barrier and hesitancy with it. And I think that on its own is an issue because you could be providing the healthcare professionals with the best resources, with the best tools. And if they're hesitant to keep an open mind, it's not going to be of any use having all those resources. So we need to perhaps spend more time understanding why the doctors and the students and every other professional is struggling with the idea of accepting digital health. And the third thing is the more obvious elephant in the room, which is time and resources. So how much are organizations in the world spending on giving time and resources to doctors to allow them to use digital health? So yes, you could, have the latest fancy gadgets out there, but if our own doctors and healthcare professionals are swamped in with working hours that are exceeding the normal limits, with extreme paperwork and all those barriers that make your life even more difficult than it needs to be, then how can we really expect these professionals to spend time on learning more things like digital health? So you see how this pyramid of problems is a very repetitive cycle. And if you don't have enough time, chances are you're not going to learn. If you don't learn, then you're not going to have the confidence, and that gives you hesitancy in using digital health. So all in all, it's a mess of many forms. And the problem with a mess like this is I don't think with the state of healthcare today, be it in any country, I don't think any health system is at ease, because when we had the COVID-19 pandemic come in, there was an increased incidence of diseases in the world, be it COVID-19 or even other diseases. And with that increase in the number of diseases worldwide, and at the same time, we've got a problem of burnout amongst doctors. So you've got this nasty combination of a lot of diseases and the workforce being burnt out. It's setting ourselves up for a nightmare. And a nice way to perhaps frame that nightmare would be a health system failure. So that isn't looking like a good picture to me. Even though we've got the money, we've got the investments coming in, it's not making sense. So the question now is, what do we do about it? I mean, looking at how we're heading towards a failure of systems and people are not able to keep up with the patient load that's around, it almost feels like the end is near. And I think that's where, something really deep comes into my life, which is the idea of going back to those inspiring role models that may have faced difficulties or challenges in one way or the other. And one of them is Steve Jobs. And I think what he said here is pretty much phrased in what we need as a lesson, which is to consider innovation as an ability to see change as an opportunity, not a threat. So yes, we might be going through a difficult time as a health system. We might be going through a difficult time in many areas, but this is an opportunity for us to create change that isn't going to take away the aspect of healthcare that we need. I think it's going to give us an ability to get even better at what we do. And that's what's innovation about. Innovation is thrown out as a fancy word, but in reality, it's really people who can see change and can believe in it enough to make a difference about it. And that's what leaders like Steve Jobs and many others have done. They've taken on these problems and embraced them as part of change. So coming back to this generation, which is, students of today, and I consider myself a student as well, because it's not been long since I graduated from medical school, and knowing that how much learning still exists even after becoming a doctor, it almost feels like you never stop being a student. So what are some of those characteristics of students of today? So I think the students of today are very different than what we see as sort of the definition of healthcare leaders that existed 10 years back or 20 years ago. So the students of today are multifaceted. And by that, I mean, they're not looking at a path that is just medicine, that is just treating one patient at a time. They're looking at a path where they can use different tools, different ideas, different hobbies to bring out something that's going to change the way we practice healthcare. And it's no longer going to be within a clinic or within a hospital ward anymore. It's going to be a form that might become a new dimension on its own. And I'll share more about that dimension in the coming slides. Students of today are also the voice for change. And we're seeing more and more of this young voices stand up for what's right and stand up for things that need to change. And I think with this very hierarchical system in healthcare, this is something that needed to be broken down a long time ago. But at least as of today, we're seeing some action and some changes where everyone has a voice. Everyone can make a difference, be it using social media or within your own circle of impact. And I think the most important point is the students of today are connected. Students of today know what it means to sort of collaborate that is going to be changing the way we see projects, the way we see, hospitals come up, because we're being taught and we're naturally fitting into a world which is very virtual. And that means you're going to be sitting with doctors and healthcare leaders that are no longer within your hospital anymore. They could be sitting in a completely other side of the world and working with you on some amazing projects a few years from now. So in that, scale of things that we look at, what is digital health of 2022? I think digital health is a very open space and quite flexible in terms of what you can do and define it. It's not a fixed space. It's continuously evolving and giving us new ways to think of how we can be a part of it. So one thing for sure is this exponential space for impact that's coming up. So someone can join the digital health field, be a part of something, and that product or that technology that's being used is no longer going to make one patient at a time become treated, but rather with the right technology, we'd be treating thousands at a time. And that's why I need you to come out of that clinic space and think of digital health as a way to create a ripple effect. So you could be sitting in a clinic with a patient, but at the same time, through technology, you might be making an impact, saving lives at that same time in different parts of the world. So that's what we mean by the exponential space. It's also the need of today, and that's something we've realized so far, because technology in healthcare is no longer something about, oh, this is a good bonus and a nice shiny thing to add to my CV or my portfolio. Technology is the only way we survive and create and leave behind an impact that's going to be measured beyond a scale that was ever used before. So it's not an option to consider technology, but rather a need. And the last thing that I'd like to bring up is just how digital health brings value for unique perspectives. I think that's something that I personally enjoy a lot in the digital health space, which is how each of you, you might be thinking that I don't have anything to offer. I don't know how technology works, or I don't know how to code. And that's totally fine, because each of you have a certain set of perspectives that you bring to the table. And that's exactly what organizations like Microsoft, Google Health are all looking for. They need physicians on the table when they create such digital health technologies. You don't necessarily need to know how to create that technology, but by bringing in your experience in healthcare, you're pretty much adding an asset that cannot be replaced by any other technical engineer or a computer scientist that is part of the team. So they need you as a medical student, as a doctor out there to be able to make a difference to patient care. Because at the end of the day, who is going to be there with those patients? It's going to be us, you and me. And that's the value for your perspective that we share. And with that value, I think it's worth looking at the different opportunities that exist. So one may ask, I mean, where do I start? There's so little out there within medical schools and within, hospitals that's shown about, oh, how can someone join the digital health space? So you've got innovation at the center of it, and then revolving around it are the different technologies, and each of them, I think, come with a very different experience. So you may explore and try to, look into, say, AI in medicine, which is something I've spent more time trying to study and understand. And maybe that's something you enjoy, or maybe you don't. And that's still fine, because you've explored something that chances are many haven't in healthcare. And then if you don't, feel like this is the right thing for you, you've got other options that are each unique in their own way. So wearable sensor technology, like, how we could use data from Fitbit, from Apple Watches to actually create and save lives. That's the future in a way too. And then you've got telehealth and telemedicine, which is already happening here as we speak. Doctors could be sitting in Dubai like myself and practicing in the UK, and vice versa. So telemedicine and telehealth is something that could be worth exploring into. Then we've got programming in healthcare, and that's something where we're seeing more and more doctors who code being a part of it. So the idea of being able to create your own apps in healthcare. So you could walk into a hospital and see a problem where an app could help make the process faster, or maybe an app could, make things more clear and save time and prevent mistakes being made by healthcare professionals. And it doesn't mean that you're doing something completely game changing, but by realizing that there's a problem and finding and filling that gap in, I think that's where real digital health comes in. It's not always about the fanciest work that you've looked at, or the biggest, I don't know, robot that you've created that cures cancer. It's these small things that add up, and it's the way of thinking that comes with it that makes it a successful place to be in. And then you've got other cool things like robotics, nanotechnology, and virtual reality in patient care, which is something I'm also exploring at the moment. So you've got research projects and in fact, treatment options where patients are given virtual reality to decrease their pain, for example. So patients with chronic pain diseases, or patients going through labor and pregnancy, these are areas where virtual reality could play a huge role. So that's another place to explore as well, as someone entering the digital health space. And how do you do that? Well, there's more than one ways. There's joining research projects. There's seeking out internship opportunities at even outside healthcare organizations. So there's plenty of firms and innovating hubs out there that are looking for people to join, volunteer, perhaps even work with them. And they might be making an impact to healthcare from the outside. And sometimes that's the view you need to see how patients can, be different when it comes to getting care. Because care is no longer today about just giving them a treatment, asking them to go home. There's so much that happens beyond it. And that's where companies, even outside healthcare, digital health companies, are seeing that, well, we need maybe care for patient at the home. Maybe we need care in detecting diseases faster. So these are things that, may not be directly inside the hospital, but just as important to healthcare. And then you've got mentorship opportunities by pretty much reaching out to people in the digital health space. These could be CEOs, these could be doctors who are, in the healthcare space and the digital health, intersection. And all it really needs is one message, one email from you that could, help mentors feel like they belong. And in that sense, they support you in that journey. So none of this happens alone. A lot of this is teamwork, and reaching out is the least we can do in taking that first step. And these are some examples. And I mean, these examples that I'm sharing are not even within medical students or doctors. These are high school students doing something within healthcare. So you've got students who built apps for maternal health awareness. You've got people in America creating apps for uh, detecting crisis in mental health among their own peers. You've got, teens creating robots to sanitize spaces in public areas. And these are all such, creative things that may not look very fancy on the outside, but they're making a difference. And that's what we need more than, the best headline. So if you have students like these who are not even part of healthcare making a difference, the question is, what's stopping you from thinking of an idea and reaching out to the right people and doing something about it? And speaking of mentors and leaders, these are a few people that come to my mind as people who inspire me in different ways. And each of them are, medically trained doctors from different parts of the world who've joined the digital health space full time. And they're making an impact on a level that perhaps not even, hospitals could have done in a lifetime. So one of them is Junaid Bajwa, who is a GP doctor in the NHS, and he's the chief medical scientist at Microsoft. And then you've got Dr. Maria, who is the CEO of Respira Labs. And that's another place where we're seeing where examples of women health leaders are there within medicine and within digital health. And if you're someone who's looking to make a mark, it doesn't have to be, from a very traditional space anymore. You're seeing every background, every person coming in, making a difference. And then you've got Dr. Bertalan, who is the director of the Medical Futurist Institute. And what he's done is, after completing his medical degree, he's gone to do a PhD, and then he created his own institute where he does videos, he does projects and different, awareness and knowledge programs that are going to help physicians and even community people learn about technology. So everyone's making an impact in their own ways. These are people who are, I wouldn't say even part of our generation. These are already, people who've graduated medical training, who've already made a name for themselves from, a few years back. But how exciting is it knowing that these are people who managed to do things like these in a world where no one talked about digital health 10 years back. So if they could do it, imagine how much we have as an example using connections, using social media, using research. It's beyond imagination when you look at things that way. And that's where research, I think, has played a big role. And in my case as well, as someone who's been very much interested in different areas of research, not necessarily digital health. This could be public health. This could be within your clinical specialty of interest. I've grown a lot because of research, and I can't give it more credit than, words could ever, because research has helped me see the bigger picture when it comes to how health systems work, policies work, what are sort of the current problems that the community faces. And you get to be really curious in that way. There's no one stopping you in asking questions, and research is the best place to answer them. It also opened the door for me when it comes to connecting with people around the world. So I've had about 30 publications in the past 2 years, and most of these publications came by working with people that are not at my university. They're not maybe even in my country. And it's not that I had any special privilege in creating these collaborations. It really just came down to being active by using social media, by trying to have a skill of networking with them, by getting outside that imposter syndrome that I am not good enough, and having an open dialogue that, hey, I am a student or a doctor, and I'm currently, in this place, and I want to learn about the work you're doing, or is there a project that we can work on together? And you'd be surprised how many are willing to accept you as part of their research collaborations. And that's the secret sauce, I think, which is, people often And students especially think that, oh, that great doctor would never accept me into their projects. And that's exactly what the other student thinks. And that's what the other, whole student community also thinks. And turns out no one ends up going to that doctor. And that person might be waiting for someone to reach out to them. So let's break those mental barriers that we create ourselves and give it a try. What's the worst that comes? It's going to be a no reply, and that's still a lot better than not having tried and having regrets with not being able to make a difference. So research is the best place you could think of in terms of creating some sort of a digital health impact, or really any impact in that sense. And at the same time, my work has helped me represent the lower middle income countries. So there's a lot of disparities within healthcare that have come from research. And being able to understand what those countries might be going through, I think it's given me a sense of humility, a sense of belonging that is outside my working space. So to be able to work on the most pressing problems of today, that could be, lack of education, lack of mental health awareness, lack of, anything you see that are happening in the lower and middle income nations. I think we can learn a lot simply by working with those researchers as well. So that's another great area to put yourself in. And I cannot emphasize enough about how mentorship has played a role in my life, because I think every decision that I've made when it came to working with organizations, choosing my speciality of practice, my interest in technology, I look back and I see there's always been someone who looked after me during that time. And if it wasn't for those mentors who could be, not very far away from you, or they could be in a completely different country, but the idea is you're connected to someone who believes in you. And there's plenty of mentors out there, really. All you have to do is try to reach out, try to use platforms like LinkedIn, Twitter. Just go out there, put yourself in a place where you could be noticed. And by being a part of these events, like these sessions, I think you're already trying that first step into seeking the right mentorship. And what your mentor does is not just give you an opportunity, but rather take your hand and give you clarity on how your idea can become an amazing project in the near future. So that's why we need mentors, and we need more young researchers to step up and take up the role of teaching others as well. And that's how you're going to get training, support, coaching, all of those things come together under mentorship. So we're really, looking back at the students of today, and with so much happening at such a fast pace, especially after the pandemic, I think we are in for a ride. We're in for a transition of a lifetime. And it's worth noting that digital health is no longer an option. It's no longer an alien word anymore. This is part of healthcare. So the more we integrate it within our lives, be it by trying to learn, using courses, using, people out there, you're going to make yourself a better doctor or a better healthcare professional, no matter what background you come from. And there's tons of opportunities. That's something that I've already shown you, because I've tried to, look into opportunities around me, and I realized the problem is not with opportunities. I think there's plenty. There's a sea of opportunities out there. What you need is perhaps that energy and that spark to be able to go out there and take an opportunity and do something out of it. And this is going to be a game changer, because we're also looking at a very competitive, healthcare field today. You might be looking to apply into a training position, be it in your country or somewhere outside, or it could be under a different position in master's programs, in jobs. And that's something that really stands out, because as of today, there's not many people who can confidently say that I've done something in digital health. I've done something in research. And I've tried to create innovation between the two of them. So take that early bird advantage and put yourself in, because that's going to shine bright on your CV when it comes to applying to those positions. And of course, don't forget to have fun, because anything that you put yourself in is going to be something you live with, really. You wake up to that idea, you go to sleep with that project. So there cannot be another option but to look at it as a way it's going to make you feel excited about the future. That's the kind of project you want to go with. What I tell other students is that, how do I know if an idea is worth taking on? Well, the answer is, does that idea make me as excited as, when a child is given a toy, and that toy is all they could think about for a bit, and that's all they want to, explore and play around with, even if they're bad at playing, or even if they don't know how the toy works. But that excitement, that spark, that fun that comes in, that's what makes us stay within the field. And that's what I think is going to bring innovation in healthcare. So doctors of 2022, like myself and many others, I think we've looked at what exists and we've looked at what could come ahead. But what about the doctors of 2040, right? Because that's the first slide that we saw today. And the answer to that is just as clueless yet exciting as it seems, because we really don't know. We really don't know who is going to shape that identity of a doctor. Are they going to be, people with the same qualifications by then? Are they going to be just humans? These are just some questions that come to my mind, and it's just showing us the reality of how medicine is a very evolving field, and the speed at which we're changing, anything can be possible. So what we really need is your excitement, your enthusiasm to be a part of digital health. And I hope this helps you open your mind and look at it from a new perspective that maybe inspires you to be someone who defines how the doctor of 2040 is going to look like. Thank you.